Hey, I'm Dr. Busti, your faculty and host on This Is Why, a show that helps healthcare professionals transform their medical knowledge from what to why. You know, this topic that we're going to be doing is focused on evidence-based medicine. It's been over 30 years since EBM was introduced as that paradigm shift in medical training. And this topic review highlights one of the main ways to effectively train healthcare professionals by covering step one, or the first of the 5 A's, which is asking a clinical question appropriately. Now, as a high-level reminder, evidence-based medicine, as it looks at a Venn diagram, is a compilation of the best available evidence utilized with our clinical expertise and experience, and obviously patient-specific factors. And when all those three come together equally and in balance, we have EBM. Now, I highlighted best available evidence because that's the focus point that not only EBM seems to gravitate towards in the things that we teach, but is obviously also the focus of what we're trying to do, get the evidence. So that's why we're on step one and why that point is highlighted. Now, looking at the steps at a higher level, we have 5 steps. Step one, or the first A, is ask a clinical question. That becomes very relevant because we need to go and acquire the right type of data. Once we find that data in step 3, we need to appraise it. And then in step 4, we apply it to a patient-specific scenario. Lastly, we assess our own decisions and we make adaptations, hopefully, to our clinical practice that aligns more with evidence and an improvement as we apply it to patient care decisions. Now, I'd first like to talk about the types of questions we often have or see throughout our careers. Now, that will vary depending on where you are in your level of training and or practice experience, okay? So, I would like to cover what is a background question and a foreground question. And I've tried to summarize that here in a table. And again, for those of you listening to this by audio only or podcast, this table is available at download at thisiswhy.health. Again, sign up for a free membership or subscription, and you can get access to deep dive content plus things like this that you can download for studying or using for your presentations or sharing with others, okay? What you see in this table are some descriptors on the far left side. Then we compare 2 of the types of questions. Again, the background question in the middle, and then the foreground question on the far end. Now let's break it down. So what makes them different? Well, it's the level of difficulty really and where we are in our training. Background questions, the purpose is to gain that foundation of knowledge about a specific topic here. Foundational knowledge. That's generally broad, introductory. Usually people are asking like, what is something? When do we do this? How do we treat something? All right, so the common form is what is, how does, why did, X, Y, Z, right? They're straightforward. So example would be, what is diabetes mellitus? How does insulin work? Okay. When we are, when we think about it in the context of a particular case, it's typically when you're new to a topic, right? So we most commonly ask background questions when we are new either to that area or we lack the knowledge and understanding of that particular topic in general. Whereas foreground, these are typically done by people who already have some experience. Okay, if you want to think about it like a medical resident, fellow, attending physicians, or clinicians who are licensed with some real-world clinical practice. These are questions to guide clinical decisions that have some element of research and clinical practice specific issue associated with it. Okay? Now, the questions tend to be a little bit more narrowed and detailed compared to the background question. So what we see in EBM is this format that we follow typically is the evolution of what is called PICO or PICOTS. I'm going to go through that here in a minute. Those are the elements that make up a clinical question that typically is more foreground in its nature. So you have a population, and how, which is an intervention. You have a comparative group, and then you have some sort of outcome or effect, okay? So for example, in adults with type 2 diabetes, I'm not just asking what is diabetes, I'm asking or saying, does metformin compared to lifestyle modification alone improve long-term glycemic control? So you see the elements and the detail of that question. It's obvious. It's not difficult to see. So this is typically when you already know the basics and you're trying to focus in and get to clarity of the depth of the decision making, the why behind you do what you do. Okay? So those two formats and styles of question become very important as we think about where the learner is, if we're an educator, but also the questions that we have. Again, sometimes as we go through life and clinical practice, we're supposed to be going through lifelong learning where our knowledge base should continue to grow. So we're going to encounter new information too. And I might say, what is that new drug? Well, that's just a background question, right? Then I might advance that to a foreground. And we'll talk about that. I'll actually walk you through an example of how to do that and how to help your learners, residents, students also walk through that. All right, so next will be the elements of the question that we use in EBM, okay? We will then convert one to another and ask, why does it matter, okay? It matters because this gets us in the direction of acquiring the right type of data, the search, okay? So that's why we're building on this topic, and you should watch these topic reviews in a series one after another because it makes the most sense of the foundation. All right, so the four main key elements that you've probably heard or seen is the PICO, right? Patient, population, or the problem. I is for intervention, C is comparison, and O is the outcome. Now, what's missing or assumed in the traditional PICO? Well, in my personal opinion, what is missing is the time frame of that outcome that you're looking for, or the type of study. Now, I will tell you in the EBM literature, the majority of things that you'll read makes that T the time of the outcome. Okay, we'll dive into that here in just a little bit more. And then S is the practice environment or the setting for which the question is being asked and in the context of the patient care scenario. So if you line those two up side by side, you have PICOS and PICOTS, right? Those additional variables allow you to find data, if you set it up that way, your search strategy, that is more narrow and focused and specific to the question that you have and that you're trying to apply in this clinical scenario. So let's now break it down a little bit further. Okay, so let's just go through PICO and PICOTS a little bit more in depth. So P stands for, again, patient or the problem. Okay, now you obviously need to consider the patient and the situation that you're facing. Okay, what is relevant to your practice? Because you don't want data that's outside of that, or you don't want a different patient population like pediatric data that you're trying to extrapolate to an adult, or vice versa. So we need to be specific but not too narrow, because sometimes being too narrow could cause us to miss some important studies. Why does that matter? Well, because guess what? You may not find your patient population. So the best available evidence might be other patient populations that you have to try to draw out some information because that's all you have access to. Next is I or intervention. Okay, this is based on what you're considering to do. Well, that might be drug therapy related, something like a medication. Okay, and so you would consider in that situation a dose, the dosage form, the route of administration, even the duration. And a lot of times the treatment protocols that we use in real-world practice came from protocol-driven interventions, i.e. how was that treatment implemented in the clinical trial. If it is diagnosis related, then it's likely a lab test or a physical exam or an imaging modality, right? Might be something if you're thinking about harm in the question, So then I is not an intervention, it might be an exposure. And that changes PICO to PICO or PECO. Okay, and so now what I'm trying to introduce to you is this evolution of different elements and formats that we use for modeling the question that we're trying to answer, because that leads to the search strategy approach to go acquire the information. Because when you find a paper, you want to be able to bring it back and compare it to your PICO or PICO or whatever your format is, and see if they align. Okay? That's what you're fundamentally doing in the background. It's sometimes subconscious, but going through this systematic approach and discussing it this way helps it to formulate in your mind. All right, C, comparison. Again, this is usually what you would likely do if the intervention in question was not available. It may also just be that you're comparing to the standard of care, especially if it's some new treatment. Maybe you don't have anything and you're comparing it to nothing or placebo. Okay? All of those are applicable and need to be factored in to your question versus what the paper is addressing. Lastly, in the main, I guess, basic structure of PICO is the outcome, O. Now, this is based on the perspective of who is asking the question. Is it the patient's question to you? Is it your question for the patient? Or is it the institution or the healthcare system's question of a group of people and or clinicians in practice? So generally it should be patient-oriented, clinically relevant, and it may be guided by the studies and outcomes of those studies, right? So sometimes our PICO question is influenced by other data. Now T, as we move on to the expanded core elements of a question, in my opinion, is appropriate. Again, I mentioned T is for timing of the treatment, timing of the outcome being assessed. It's influenced in part by the setting. My timing in the emergency department for a desired outcome might be seconds, might be an hour. In the outpatient ambulatory care environment, it might be 30 days, 6 months, 2 years. Okay? That makes it applicable to the type of environment and situation we're trying to address in the question. The other way I've seen T be labeled is the type of study. Some people want only randomized controlled trials. We've seen guideline committees do that. They will eliminate and only utilize information from certain types of study design because of the risk of bias, and they want things that are internally valid for making guideline position statements. Okay? So it's appropriate to consider, but most commonly T is for timing of the outcome or the treatment. Lastly is S, that's the setting, the clinical environment. Is it acute or chronic? Kind of alluded to that in the timing just a minute ago. So that's going to be a short-term versus long-term outcomes. May also consider the studies that are evaluating the problem. Okay? So all of these things kind of help guide us. They can either narrow in or broaden some of our results. Most cases, if you do PICOTS, you're going to narrow in on those papers that are more specific. But you might miss the one that's helpful. So don't assume that because you didn't find it, no data exists. Okay, so when we bring all those formats together, okay, and we think about all the various elements of the types of questions that we would ask in EBM, you can see that those that are for interventions over here on the far left, we have PICO and then plus or minus PICOTS. Again, both versions of T and S. Again, this table is available at thisiswhy.health for a download for those of you that want this to use, to study or share. There's exposure, PICO, PICOS, PICOTS, right? That E is exchanged for the I. So remember, I is intervention, E is exposure. PERT or PERTS, that gets into diagnostic tests where you have I is the index test, R is the reference comparative test or the standard, and then T in this case is the target condition of that diagnosis, okay? The target condition of the diagnosis. The last one is PIRO, This is where outcome is used instead of targeting a diagnosis or a disease. PIRO being, again, patient population index test, the reference or standard text, usually the gold standard in most cases. So these kind of summarize the different formats and the elements that make up a good clinical question. And some search engines, when you go to search out and try to acquire this information, actually have tools built in to their search box that allow you to fill in some of these things to help you narrow in, which can improve your search sensitivity and specificity. All right, now let's look at how to convert from one type of question to the other and why does it matter? Because again, remember, we're pointing to that process about what are we doing with this process? Like, it seems tedious, and I would encourage you not to blow it off or to perceive it as tedious. It actually will save you an enormous amount of time and get you to the right type of information. All right, so let's think about the example related to asthma, okay? What is a typical background question? We've already alluded to this earlier before, but it might be something simple as, again, typically a student level question. What is asthma? Okay, very broad, very general nature. Remember, that has that same format. What is XYZ? How do we turn that into a foreground question? Again, more in depth, narrowed, detailed, has some clinical scenario context in it, typically meets the criteria of a PICO, right? PICO typically format. So one example might be in children with moderate asthma, right? That's your P, that's your patient population and problem. Does inhaled corticosteroids, i.e. that's your intervention, compared to as needed albuterol, comparative group C, reduce the frequency of exacerbations? Again, I'll just read it. In children with mild or moderate asthma, does inhaled corticosteroids, how does inhaled corticosteroids compare to as needed albuterol as it relates to the reduction in the frequency of asthma exacerbations? Well, that's a lot more detailed in context of a question than compared to somebody with a background. Let's do another one on hypertension. So again, you might say, how is hypertension treated? It seems a little bit more in detail, like I understand hypertension, but what treatment options do we have for this patient, this condition? Again, what would be a conversion to a foreground? And the reason I'm going through this exercise is because, one, depending on who you are, what your role is, if you're an educator, attending, preceptor, you might need to lead and guide your learners and trainees to ask them more transition to that more foreground question, especially if you're in the context of applying evidence. But the other thing is, again, it guides them to the next step. So for example, in adults over the age of 60 with hypertension, so you just defined the patient population right there, does a thiazide diuretic compared with an ACE inhibitor, more effectively lower the blood pressure and reduce the risk of stroke? Wow. That means you not only know what the treatment options available are, okay, not only these two drug classes, ACE inhibitors and thiazides, but you are asking very specifically, how do those two compare? Which one do I pick now? And it's specifically as it relates to not only lowering the blood pressure and getting the goal, but also reducing patient-oriented outcomes. Very much more astute and detailed and focused in nature. Now, what would make answering the background question easier? Well, understanding the why. That makes the foreground question also easier. So when we talk about core knowledge, core concepts that we teach, that I teach on this show and this episode, since that we offer at This Is Why, we'll hit some of that core knowledge, but I don't want you just to stop there. I want you to go, okay, here are the treatment options for hypertension, but why do you pick this agent over this agent in some scenarios? Why do you select this group of drugs over this group of drugs in another kind of patient scenario? That's the rationale behind the decisions, which is really what a foreground question. So you have to understand some degree of the why you do what you do with what you have. That makes the how, the question, which seems very basic, how do I treat it? Well, remember, the way we make how easier is by knowing the why. So this is why we talk about converting the what, transforming just what information, facts, to why, because that makes the how easier when I understand why I'm doing what I'm doing. Why do I pick one agent over another? Okay? I don't mean to beat that up too much, but all of this matters in the context of evidence-based medicine because you're developing a structured, answerable clinical question that's setting you up for a successful search strategy. Step 2, acquire the best available evidence. So it helps you to focus the limit to a search type based on a study design or a time frame or a patient population or even when it was published. That improves the overall efficiency of implementing evidence-based decisions in your practice. Otherwise, you're never going to get anything done because you don't have all day long to spend searching for content in the search engines like PubMed, Embase, and all these, and reading then hundreds of articles. You need to find 2 or 3 and answer the question that you have. So let's consider now an application. Let's consider the PICO for a clinical or foreground question about older adults over the age of 65 who are experiencing an ST segment elevation MI. And what kind of impact does aspirin have on mortality? Okay, so I gave the patient population, I gave you an intervention. I did not just mention a comparative group, but we'll just say doing nothing. Aspirin versus nothing. And what impact does it have on mortality? Now you might pause and go, well, wait a minute. All mortality is not the same. That is true. Some people love it to be all-cause mortality. Well, that's great, but that's sometimes harder to demonstrate. So it might be vascular-related mortality. Okay? That's more specific, but more applicable to the patient population that we're dealing with. So when we break down that scenario, we apply it in the format and the elements of PICO. Now, I'm not including the time and the setting, but if you think about it, the timing is probably the acute care environment. They're going to be admitted to the hospital. The setting would be acute care environment. Okay? So now you could turn this into chronic because now the patient's been discharged from the hospital out in the outpatient. Now your T and S are different. Okay? So that's how you kind of use it. But I want you to follow me here for a second. Again, this makes sense of the why the structure of the elements matters. So I fill in the blanks of this PICO table mentally or physically. And so the patient population and the problem represent adults over the age of 65 with STEMI. I is the intervention, which is aspirin. Typically we give a loading dose followed by baby aspirin once a day. And then comparative group is placebo. Outcome is all-cause mortality. Well, what goes underneath that empty section? Those are the search terms. Because when you look at some of the terms that we used in our clinical question, you have to think beyond those words sometimes. I mean, ST segment elevation MI might just be a myocardial infarction, acute myocardial infarction. It could be acute coronary syndrome, or it might just be a heart attack. I mean, if you think about all the different key words that are used in a search title, abstract, or the paper, there's going to be variability in sometimes the terminology that is used. And that's where mesh terms can be very helpful in a search strategy, because it's kind of like the thesaurus around these words and these topics. I know that when I submitted papers for publication, I had to put those mesh terms and the thesaurus of words associated with keywords in my title and my abstract so that people could more appropriately find the right thing. And so it can be cataloged by the National Library of Medicine appropriately. Same thing with aspirin, right? You can have anicin, bufferin, salicylic acid. All of those things would be applicable. The reason why you don't want to ignore some of these, and that's why you see the Boolean language or, is so that we will get more results, but we're not likely to miss the paper that we are looking for. Placebo is placebo, outcome, mortality, but what is also mortality? Well, whether you were dead or alive, right? So death can be there. So when you combine these two things together and these concepts at a kind of a higher bird's eye level view in EBM, the format and the elements of the question, as you see in this particular table, PICO, PICOTS, PICO, PERT, based on the type of question, is it a therapy or treatment question? Is it a diagnosis? Is it a prognosis? Etiology, quality of life, behaviors like qualitative studies, right? That influences the T type of evidence that we would desire. What would be the preferred, if we're going to go out there and have to sift through papers, and some of the search engines allow you to have filters like only display to me human randomized controlled trials. Because if it's there, that's going to be the best available evidence, isn't it? If you have a Cochrane review of RCTs, wow, that is the ideal scenario. I mean, if you think about that hierarchy of the evidence, at the very top is a meta-analysis, a systematic review meta-analysis, typically a Cochrane review even a little bit above that, because it's just so rigorous. But you want those to be of good, solid data like RCTs. Well, that might not be realistic. But you should still think of what is the type of evidence that would be most appropriate for answering that type of question, and then what elements of the question format will get me there the most efficiently and effectively. And again, this table can be downloaded at This Is Why for you as well. Okay, guys, I hope that was helpful in covering step 1. We're going to move on and do another topic review on step 2. Please follow along. Please build. Once you have this foundation and you do it a little bit, it becomes part of just the systematic process that you do, and it makes doing evidence-based medicine much easier. Plus, we want to teach and train the current and next generation to do it correctly in its proper context. Guys, I'm Dr. Busti, and this is why we're here, to invest in each other, helping us understand why we do what we do so that we can master the how. And in this case, it's about how to ask an appropriate clinical question, because when you know why, you don't just begin practicing medicine. Remember, guys, we are transforming it. Thanks.